Hello, everyone. Recently, the CFPC released this 2016 report card that assesses how the federal government is performing in the area of healthcare, and I'd like to share the results with you. Our new document builds on our first report card from 2013. It rates the government's positions and actions based on 23 indicators of importance to family medicine in which the federal government's involvement is required. These government-focused documents are a way for us to ensure that the healthcare system in Canada is shaped with the input of family physicians and reflects their priorities as well as those of their patients. Our report card uses a color scheme with 3 levels: green, indicating areas where the government is showing strong leadership; yellow, pointing to areas where there has been some activity but where more can be done; and red, indicating areas where nothing is being done and where immediate attention is required. Overall, the 2016 report card shows tentative progress since our previous edition, and with some of the government's actions since it came into power last year. Some of the areas with green grades are building on the National Immunization Strategy and supporting Indigenous health programs. Most indicators continue to have yellow grades. However, and examples of that would be developing a national program to improve the affordability of prescription drugs, investing more in mental health and addiction treatment strategies, and addressing health inequities in rural and remote areas. Of particular concern are those areas in which the grades continue to be red or have been downgraded from yellow to red. Some of these areas with red grades indicate a lack of action on supporting the patient's medical home model of care, supporting primary care in general, and setting national goals for certain areas of health and healthcare. In creating this report card, the CFPC acknowledges that the new government is still early in its mandate. We encourage the government to move quickly on its pledge to commit $3 billion in funding to a national home care program as part of an overall commitment to strengthening primary care. The College has been working on this issue with the Canadian Nurses Association and the Canadian Home Care Association. Our proposed approach will help patients better manage transitions in their care and will ultimately improve their autonomy and dignity. The report card also emphasizes the need to act on social determinants of health. The patient's medical home model is designed to address the social and economic factors that affect health. We hope to see greater government support in the future to help to foster family practices that are responsive to community needs. The report card helps guide our interactions with government and opposition parties. We refer to this document in our ongoing meetings with government representatives and offer our advice on how progress may be achieved in all categories. In fact, in late November, some of our staff and I met with representatives of the Liberal Party, the Conservative Party, and the NDP to discuss the report card. And it was very well received. We had very good conversations. We also included some conversations around the role of family practices to evaluate innovation in home care through quality improvement initiatives. I hope you'll take some time to review the report card, which is available through the link provided. I welcome your comments here, by email, or on Twitter. Until next time, take good care.